Chairman, sir, and honorable ministers, ladies and gentlemen, I'll just quickly explain the slides that was shown by the chairman so that we can understand some areas. For the first slide, I think that's the chairman already explained what we have there, the number of samples that we have collected over the months, and we can appreciate what is happening. That August, we're having a very low number of samples collected. For the next slide, I think that's where I would really want. Now, for this, we have states with decreased samples collected. That is, we have 7 states in July, and unfortunately in August it increased to 32. We can appreciate that number, that the number of states that are now collecting less samples have increased to 32 in August. And then in terms of the increase in samples, about 1,000 per state. In the month of July, we had 13 states that actually collected over 1,000 samples. Now for August, no state met that target. That means we had 0 states collecting over 1,000. And then in terms of the states with over 1,000 samples in the month of July, we had 23 that collected in July, while only 18 for the whole of July. And for the whole of August, only 18 reported. And then in terms of the LGA, in July we had 515 LGAs that collected samples, and it decreased to 478. We can appreciate the decrease in August. Next. Now, this is showing us states with our biggest increase in July. They are listed there, and those ones with our biggest decrease. Now, let's go to August. Those with our biggest increase are Abia, Sokoto, Bayelsa, Zamfara, and Yobe. But the numbers are very not significant at all. You can see the numbers. The highest is 682, with a big increase, while the biggest decrease are Kano, Lagos, Oyo, Edo, and FCT. These are our biggest states that have been recording a high number in terms of confirmed cases and also the number of samples that are collected. So this, we can appreciate what is happening in the state, and that's what has the August sample collection has decreased drastically. Now, this is where this test being conducted, where being collected, the samples being collected. Now we have, in July, the number of states, that's Benue, Ebonyi, FCT, Lagos, and Plateau. All the states, all the local governments in those states had samples collected, and they were quite good, while only in Delta, Edo, and Ogun, only 1 LGA did not collect sample, as it is listed there. Now, in terms of those that high LGAs that they did not collect sample, Kogi had 19, and the 19 is out of the 20 local governments in Kogi. Now we go to August. August shows us that Ebonyi, Imo, Lagos, and Sokoto, also all their LGAs, they collected samples, so none of them did not collect. And then we have Edo. But the part I want to bring out from here is that even though Lagos, we had a high number, all the LGAs collecting samples, but the number of samples collected was quite low. So that actually brought down the number of samples collected for August. And so they are listed there. And the numbers that have high, you can see Katsina, 24 of their local government. And then Kogi, actually no local government is collecting sample in Kogi State. So I think we can appreciate what is happening in the state, and why we're having very low sample collection for the month of August. Now I'll quickly go to what I really want to discuss today. And today we're talking about surveillance, surveillance efforts, which also talks to this presentation, because our priority since the beginning of the outbreak has been for us to be able to detect, trace, isolate cases of COVID so that we can prevent further spread of the virus. And for us to be able to do that, we should be able to collect samples, be able to detect, collect the samples, and isolate if they are confirmed. However, in a country of over 200 million people across 774 local governments, this resource intensive is very rigorous. In many ways, we have intensified our surveillance activities to not only understanding the epidemiology of COVID within our context, but to help us to respond accordingly. This also feeds into our guideline, which we have produced, and advisories which we have developed and sent to states. Now, a few years ago, before, of course, COVID, we have a digital surveillance called SUMAS in Nigeria, and this SUMAS allows real-time case-based surveillance from health facilities to the local government, to the state, and then to NCDC. Actually, from health facilities, real-time, you get that information out at the NCDC, at the national level, and then the local government. But each level owns their data. Each level is able to, analyze and do a lot of work with the data. And we have actually leveraged on previous disease outbreaks like Lassa fever in the country and now COVID. Each time a new case is recorded from any part of the country on SUMAS, we immediately view it at our emergency operations center on the dashboard. So using SUMAS at a glance, we can view the number of cases and specific indicators for each case, their symptoms, the current status. It's a whole package that gives information on how a case is managed up to the laboratory samples that are collected, and this allows us to be able to harmonize our outbreak response. Since the beginning of this response, we have rapidly scaled up our deployment of SUMAS across the state. I'm happy to inform you that it's only 2 states that are left for us to roll out SUMAS, and that's Abia and Enugu. And from next week, we're going to do that. So before the end of next week, early September, we would have rolled out SUMAS in all the states of the Federation. And so this SUMAS, in addition, allows us to do contact tracing. That also helps us, which is one of the core surveillance activities we have employed in this response. And this entails follow-up of people that have been in contact with a confirmed case of COVID to ensure that they do not infect others. We monitor them regularly for 14 days to ensure that they do not develop symptoms and then not infect others. For this response, NCDC has trained state teams in improving surveillance, including the case definition and investigation and reporting. We have supported states to engage SUMAS data clerks and SUMAS surveillance officers to aid the states, even up to the local government level. Of course, we are grateful for the support of the Africa CDC, for the engagement of 200 community health workers. That's to enhance our contact tracing activities. In addition, the NCDC has continued to develop and update existing guidelines as the knowledge of the disease evolves. Recently, we have published and shared with states strategies to improve surveillance for COVID, and this is accessible via the covid19.ncdc.gov.ng. This is a guiding document that helps state teams to be more strategic in the implementation of the activities to improve the overall response to COVID. To date, preventive measures have been recommended have been informed by the epidemiological data on COVID in Nigeria, as well as observable trends across the country. We continue to urge Nigerians to support states and the national effort to curb this disease, and this includes adhering to preventive measures, such as the use of the face mask, and getting tested if you are showing any signs of COVID, and spreading information only from official channels. Thank you.